TOCK, We Don't Stop Self-Management Program for Those with Heart Failure. This presentation was created and narrated by Jody Forbes, FNP, DNP student at Jacksonville State University. The table of contents is listed here. The objectives of this presentation are heart failure and its effects, the TOCK, We Don't Stop program, DNP competencies for program development and implementation, and outcomes metrics will be addressed throughout the following PowerPoint slides. Heart failure affects millions of Americans and greatly impacts the cost of health care in the United States. As the population ages, the numbers are expected to increase, placing even more of a burden on the healthcare system. DNPs are educated and prepared to create forward-thinking, innovative programs to mitigate the negative effects of heart failure on individuals and organizations. This presentation will introduce the TOCK, We Don't Stop self-management program for those with heart failure. Throughout the presentation, the program's development, implementation, and outcomes metrics will be discussed. According to the American Heart Association, there are currently 5.7 million Americans living with heart failure. Annually, there are 670,000 new cases reported. National healthcare costs for heart failure management is ranked among the highest. Some risks for heart failure include hypertension, hyperlipidemia, tobacco use, diabetes, overweight, obesity, and unhealthy diet. Fortunately, many of these risk factors are modifiable, and lifestyle changes can prevent heart failure for some individuals. However, for those currently suffering from heart failure, there is a need for self-management programs and tools that can improve quality of life and outcomes. In fact, the American Heart Association developed an innovative application, Heart Failure Path, that follows a self-management framework for patients living with heart failure. The application will be utilized for patients enrolled in the TOCK program and will be discussed further during this presentation. According to Healthy People 2020, significant disparities exist with heart failure and the population affected by this disease. A person's level of education, socioeconomic status, geographic area, and biological factors can create disparities. The TOCK program aims to address several of these risk factors and aspires to improve the health and quality of life for people living with heart failure. According to Cup, Curley, and Vitale, DNPs must assess the population of interest for modifiable and non-modifiable factors. Therefore, the focus of the DNP-led TOCK program is directed toward changing the modifiable risk factors to improve health outcomes and quality of life for patients with heart failure. The TOCK program requires an interdisciplinary team approach. Like the gears depicted in this slide, any absent team member would cause the program to stall. During the planning stage of the TOCK program, the DNP assessed the needs of the heart failure population and assembled a team of professionals to help guide the development of the program. The team consisted of a cardiologist, a cardiac nurse, and a billing coder for the cardiac clinic. Finally, the DNP presented the TOCK program to senior leaders and administrators at the cardiac clinic to garner support and funding for initiation. The next several slides will describe the roles and responsibilities of the team members. The cardiologist will be responsible for the initial evaluation and patient referral. The cardiologist will identify the eligible clients and ensure the patient moves through the approval process for participation in the program. Eligibility criteria for participation was adapted from a similar program developed for a study in Singapore after previous studies revealed a need for such a program. The eligibility criteria adapted for the TOCK program includes 55 years or older, ability to understand English, possess a smartphone, laptop, or tablet, have transportation, and the ability to be reached at home after the initial classroom education session. The cardiac nurse manager will be appointed to the team and give feedback on the concerns or barriers of the clinic and nursing staff. The nursing staff members will be responsible for acquiring consent from patients and scheduling a classroom teaching session. Nursing staff will be trained and directed by the clinic nurse manager on how and when to perform follow-up phone calls. Qualitative data will be collected via the follow-up phone calls, and quantitative data will be collected at follow-up clinic visits and the Heart Failure Path smartphone application developed by the American Heart Association. The billing director will ensure the program complies with the Centers of Medicare and Medicaid Services regulations. If the program is not payable by the CMS, the clinical director can assist the team in identifying alternate payment or funding methods for the TOCK program. On a case-by-case basis, patients that do not have a payment method for the program may participate with either an out-of-pocket payment or a scholarship opportunity. Ultimately, administrators will need to be assured that the TOCK program will not only help the patients, but the organization and community as a whole. If the cardiac clinic is suspected to suffer financially due to program implementation, senior leaders and administrators will not likely approve. The DNP will present the program to senior leadership for approval. Any negative findings of the program will be discussed with the team and revised as necessary. Funding and payment sources will be discussed and will describe organizational as well as patient and community benefits. Senior leaders will have the role and responsibility to approve implementation of the program or offer suggestions of revision before approval is granted. Lastly, and most importantly, the patients and caregivers must be informed and consent to participate in the program. Patients and caregivers will need to recognize and believe in the program. The cardiologists and nurses will provide patients with an information packet for the TOCK program. Moreover, patients will be concerned about the cost of the program and if their insurance will cover this cost. The billing department staff will be able to provide this information to patients based on their individual policies. The TOCK program is a simple 3-step program that allows patients to learn how to use the American Heart Association Heart Failure Path application. The orientation will take place on site of the cardiac clinic in the classroom 1A. Patients will bring their smartphone, laptop, or tablet to class, and the instructors will assist patients with downloading the application. Once everyone has access to the application, the instructors will walk patients through creating their profiles. Time will be allotted for patients to take the initial heart failure surveys prompted by the application. When the class has completed the initial questionnaire, the instructor will progress through the application and explain how each section will be used daily to track medications, weight, and symptoms. Additionally, patients will be instructed on how to message and interact with others through the Heart Failure Path application. At the end of the session, patients will understand how to navigate and utilize the application and the importance of tracking their information. Prior to dismissal, clients will schedule follow-up phone calls weekly for 3 weeks and a follow-up visit at 1 month. Contact information for the instructor will be provided to each client for technical support issues during their time in the program. Step 2 is a series of follow-up phone calls. Post-orientation, patients will receive a weekly phone call for 3 weeks. Patients will be asked to answer questions regarding their ability and success in navigating the Heart Failure Path application. Questions will be answered and patients' concerns will be documented for further use to improve the orientation and other facets of the program. Step 3 will consist of a follow-up visit to the cardiac clinic. Patients will be reminded to bring their smartphones, laptops, or tablets with them to the appointment. The cardiologist will perform an evaluation and review the patient's tracking. Data from the phone call surveys and the follow-up visits will be used to measure outcomes. Outcomes metrics will be discussed in more detail later in this PowerPoint presentation. But first, leadership competencies required to develop programs will be addressed. The American Association of Colleges of Nursing established the Essentials of Doctoral Education for Advanced Nursing Practice. Outlined in the manuscript, Essential 2 addresses the DNP's ability to lead organizations and systems toward quality improvement and systems thinking. The abilities of the DNP include the ability to create and implement plans to improve health of populations, ensure quality healthcare provision, communicate at an advanced level, and utilize knowledge of business principles, finance, economics, and health policy to implement plans for practice initiatives that will improve the quality of care. The DNP should not only be proficient at providing direct patient care, but also have cognizance of the needs of a set of patients, as in a community, target population, or a panel of patients. Considering this essential skill of the DNP, it is feasible to have programs developed and led by DNP professionals. Therefore, the TOCK program will be created and implemented as a DNP-led program to benefit the heart failure population. The AACN Essential 2 and the American Nurses Association Leadership Institute Competencies for Leaders are complementary. Several of the ANA-LI competencies for leaders are business acumen, systems thinking, influence, and change. These are requisites for planning and implementing the TOCK program. For instance, with the competencies of business acumen and systems thinking, the DNP will have a full understanding of the target population's needs in combination with the organizational, social, and political factors that impact the program's success. Further, systems thinking will allow the DNP to establish collaborative relationships that will foster program vitality and longevity. In addition to business acumen and systems thinking, the DNP will demonstrate influence and change by inspiring others and gaining support for the TOCK program. Persuasion and motivation of the program's interdisciplinary team will nurture a spirit of change. Even so, resistance to change may come along, and the DNP must strategically and skillfully overcome resistance. Moving forward, the next several slides will discuss outcomes metrics used to evaluate and improve the TOCK program. Qualitative data will be collected from clients with standardized surveys given during the follow-up phone calls. The short questionnaire will be conducted at each weekly phone call. Patients will have an opportunity during the call to ask questions and give feedback. These calls will be recorded and themes will be identified from this data. This slide gives an example of the questions that will be asked during the follow-up phone call. The questions will be answered with a scale ranging from strongly agree to strongly disagree. The patient will gauge their comfort and confidence level in using the heart failure path application. Quantitative data will be gathered by chart review from the patient's follow-up clinic visits. The New York Heart Association classification will be performed at the 1-month follow-up visit and will be compared to the patient's NYHA classification prior to completing the program. The heart failure path application will provide valuable information to the clinician for making an accurate classification. This data will be used to evaluate the effectiveness of the program and reveal needs for revisions. This slide illustrates the NYHA classification for heart failure. During the follow-up visit, this chart will be utilized by the cardiologist to determine if the program has had an impact on the patient's heart failure classification. The TOCK program aims to promote increased quality of life and better outcomes for patients managing heart failure. As mentioned earlier, risks for heart failure and barriers to self-management include transportation issues, education, and support. The TOCK program was designed to utilize the heart failure path application created by the American Heart Association in combination with a classroom session and follow-up phone calls and visits to promote self-management. Studies suggest that improved self-management can elevate quality of life and reduce healthcare costs. An interdisciplinary team comprised of healthcare professionals and patients will ensure collaborative efforts and increase the potential of program success. Outcomes from surveys and chart reviews will offer insight to program and process improvement, as well as highlight the positive impact of the TOCK program.